Hello, doctor.
Hello.
We are back. Can you just tell, like, we can use honey in the dummy while child is going through a teething phase?
Okay. So honey is not recommended for babies less than 1 year of age
Okay.
because there's a high risk of developing botulism. There's an infection which is caused by a bacteria called Clostridium.
Okay.
Okay. So it's not safe to give.
So, apart from honey, what we can give to a child? Because generally it was saying when the teething stage, kids may feel the irritation or itching sensation. So what you can advise?
Like you can give fresh fruits.
Okay.
Okay. Like there are certain like which we can order online, in which we can insert a fruit, and when the baby tries to chew it, or then only the juices will be like transfer by when it crushes, the juices will go inside the baby.
Okay, so guys, if the baby is in that phase, just give him or her some fruit or something.
Yeah.
So that will really affects the baby to growth as well as the taste also will be good
Yeah.
to a baby, right? Okay, so I want to ask you one more thing. Many people thinks that the baby walker is really effective to the baby to walk early. Is it really true?
No, that's absolutely false.
Okay.
In fact, the baby walker delays it.
Oh, okay.
Okay, because walking is not only just the action of legs; it's the ability of the baby to pull to stand, and they have to balance, and it depends like they have to walk independently. So when you give a walker, in fact, they're getting more support. Okay, and many parents they have a feel of comfort, like when the baby's in the walker, they are safe. In fact, as per the latest studies, what we have seen is like using baby walker is not safe.
Okay.
Okay, because the baby, they are in a rush. Sometimes they fall down from the stairs, or they walk from the baby walker itself. Their head gets injured, or either their toes, or even their fingers as well. Like it gets trapped.
Okay. So it is not recommended as you said.
Yes.
Okay. So when can we use a walker?
Actually, frankly, it's not required.
Okay.
Because at the right time, the baby will like it's like a milestone. First, baby will try to stand. Then we call something as cruising. Like cruising is like when the baby is walking, and they'll take the support of the furniture or something like that. They'll like start walking independently.
Okay. And a very important question now, as a couple is going for a office or they are busy in some work, then give gadgets to our kids to go with the
Yeah.
screening. So and as per what I refer, because of access screening, children is affected with the autism.
Okay.
So, what you advise? At what age we can give a screening time for a kid? Is it really that much important for a kid, or it is really affected because of screening? Child is brain development is not proper, and he is or she is going to a autism part.
So ideally, screen time is not advisable.
Okay.
Especially less than 2 years of age. There should be zero screen time.
Okay.
Okay. And after 2 years, 2 to 6 years, it's like not more than 1 hour per day.
Okay.
And even after 6 to 8 years as well, the screen time should be in the presence of the parents.
Okay.
Okay. Why? Because in this era, we are not able to control. Like there are so many activities, which is there in the screen as well, like in the YouTube, which you can't control. Like certain things which are not good for the kids to see.
Exactly.
Okay, so it affects the development as well. Okay, so when you give more screen time to your kids, like there's something known as virtual autism, but it's not still medical. It's not yet defined. But what studies have shown, like once the screen time is too high, like there is a lack of concentration for the kids, and they are not able to focus. Even the parent-child relationship also is affected, and there is a delay in the language development.
Okay.
Why? Because screen is just one direction. You're just listening,
Exactly.
but you're not talking with the person. Like how do we talk usually? Okay, and those kids are very hyperactive as well.
Oh, okay.
Okay. So it's better we avoid screens. Like we should do what we were used to do initially.
Exactly.
I used to come from school, then we used to play with our friends.
Exactly.
Okay. And we used to go in the mud. We used to cycle.
Right.
So all those activities we have to bring back. Okay. Actually, these things happened especially after COVID.
Right, right.
Most of the mothers as well as parents, they did not have maid, and they have to cope up with their office work, with their household works. So the easy thing for them was to give them the phones.
Exactly.
And what we have noticed as doctors as well, like after the COVID, there has been a lot of cases with developmental delays due to the use of the screens. And even what I've seen in my OP practice is that, like when I advise parents to reduce the screen time, I've seen a significant improvement in the kids as well.
Okay, okay.
Okay. So now, if your parent whose kids are already being affected, I would advise reduce the screen time and let them play with your own age group kids.
Exactly.
They pick up fast with their peers actually, as compared to the adults. Like you can send them to play school, okay, and let them have more activities like with their play group. Suppose if you have any neighbors, you have the same age group kids, like you keep a time, like during this hours let the kids come and play.
Exactly.
Okay, you make a timetable for the kids as well.
Okay.
So that they will also be well versed with it.
Okay, so parents, I request you all, although you are very busy, please don't give your child any gadget for screening. Okay, try to spend time with them. I know it's hard, but try to do these activities or send them for any cross motor activity skills or let them, learn new things. But please stop using the screening. Okay, okay, and when can start cow milk or buffalo milk to kids? At what age?
Yeah. So cow milk or the buffalo milk, it is not recommended at all less than 1 year of age.
Okay.
Okay. Because the protein which we have in the mother's milk is different as compared to the cow or buffalo milk. So it's very hard for the small babies to digest those proteins.
Okay.
And they have too much of salts,
Okay.
like sodium, potassium. And there are many like important like iron or zinc, which is very less in as in like cows or buffalo milk as compared to the mothers. Okay. Even after 1 year also, we recommend only 1 to 1.5 cup. That's it. Not more than that.
Okay. And one very important thing, as it was saying, like it is really important to keep oil on a forehead or on while massaging the baby. So is it really helpful?
No, it's not actually.
Okay.
See, God has created the babies. It's a fontanelle. Okay. So when the during the birth process, the skull is the main part which is very difficult to pass through the pelvis. Okay. So when we have the fontanelle, the skull can, it can come together, and then once it comes out, it can again go back to its place. That's the purpose we have the fontanelle. And the brain grows at a faster pace in the first 2 years as well.
Okay.
So it automatically closes by 18 months of age.
Oh, okay.
We do not need to do anything.
Last question is why baby poops 2 or 3 days after? Many times.
Yeah. So sometimes what happens, like baby, like consumes all the components of the breast milk,
Okay.
like all the nutrition. So there is nothing left to eliminate. So that's why sometimes like baby passes in 2 to 3 days. That's absolutely normal.
No
Nothing to
problem,
worry.
right?
Yeah.
Okay. So let us just tell like whether it's a myth or a fact.
Okay.
Okay. So first one, new babies generally see only black and white images.
No, that's not true.
Okay.
Like they can't see that clearly.
Okay.
Like by some weeks, like they can see up to some distance only, and gradually the vision improves.
Okay.
But they can see all the colors. It's
All
not
the
like
colors.
yeah.
Okay. So it's a myth, guys. So don't take it like a child only can see black and white. Okay. Will the newborn baby will sleep on the stomach, on the support of the stomach, or he can sleep on the back?
Yeah, so it's recommended that we make them sleep on the back. Okay. And not on the tummy. So there is something called as SIDS, that is sudden infant death syndrome.
Okay.
Okay. So what they've noticed is when you make the baby sleep on the tummy, they have seen that there are cases of sudden increase in the death rates actually. Okay. So what they have done studies like these deaths they normally happen between like morning 12 to like the midnight 12 to morning 6 o'clock.
Okay.
Okay, and like we don't know the exact reason, but it might lead to certain suffocation, and there is no absolute reason for the reason like why it is going into deaths actually. Okay, so it's better we make the baby sleep out the back. And there's something called as tummy time. Yes, we can give some tummy time. Like newborn babies, they're more prone to develop, like some gas in the tummy, because when they drink milk, along with the milk, they take some air as well. Okay, so what they say, when we give tummy time, just for a few minutes under observation, some gas, like whatever is there in the tummy, it gets released. Okay.
So guys, please try let the baby sleep on the back. If the baby, turn side and sleep on the support of the tummy, please try to make it in a back way only. Okay. So next question is like, babies will feel the pain.
Yeah, absolutely.
Okay. Because many people said like, no, babies are into a growing stage. They will not feel the
No,
pain.
they absolutely feel the pain. Okay, like if they have any tummy pain, they keep on crying, or like they can have ear pains as well.
Okay.
Okay, so like when you go to the pediatrician, they'll be able to see better, because since babies are not able to communicate with you,
Yeah.
so there are certain signs which the health practitioner will pick up, and will come to know like what might be the probable reason.
Okay. So guys, babies can feel the pain, and many times I heard from the elderly people like massaging is the best way to keep the bone strong for a newborn, right? So is it really a myth or a fact?
No, that's absolute myth actually.
Okay.
So what they feel is like, once they apply oil, it will reach till the bones and will make it strong.
Exactly.
Nothing is going to happen like that.
Okay.
Okay. Like if somebody massages you, you feel comfort and you sleep for a longer period of time.
That's right.
Okay, because you go in the relaxed mode. That's the same thing with the babies as well.
Okay, so guys, there is nothing like oil will absorb and the baby's bone will be the strong. So it's just the baby to get relaxed. Okay. That was Dr. Ragi Rajan. Please like, share, and subscribe my channel. Stay tuned.